आइए हम सुने विज्ञान की अनकही कहानियाँ। आइए हम सुने विज्ञान की अनसुनी कहानियाँ। एक नई दुनिया की आवाज आपकी आवाज, विज्ञान की आवाज, की आवाज।
Celebrating Azadi Ka Amrit Mahotsav, we bring you a podcast series on STEM popularization. Science, technology, engineering, mathematics and medicine. Supported and catalyzed by the National Council for Science and Technology Communication, Government of India. This program is produced by Media for Community Foundation. Creative content and technical support is given by Salam Namaste Community Radio, Noida.
एक नई दुनिया की आवाज आपकी आवाज, विज्ञान की आवाज, की आवाज, की आवाज।
आज की प्रमुख स्टेम पॉपुलराइजेशन जानकारियाँ।
ऑस्ट्रेलिया के समंदर तट से बाहर निकला पक्षी एक युवा कैसोवरी था। इन पक्षियों की शक्ल अगर आप नजदीक से देखेंगे तो आपको ये डायनासोर के रिश्तेदार नजर आएंगे। बहुत हद तक शुतुरमुर्ग की तरह दिखते हैं, या यूं कहें कि ईमू की तरह। इनकी ऊंचाई ज्यादा होती है, टांगे बेहद मजबूत होती हैं और इनके पंजे बहुत ही नुकीले होते हैं। कैसोवरी ऐसा पक्षी है जो उड़ नहीं सकता। आमतौर पर पापुआ न्यू गिनी, पश्चिमी पापुआ, आरू आइलैंड और उत्तर पूर्वी ऑस्ट्रेलिया में पाया जाता है। इस पक्षी की 3 प्रजातियां खत्म हो चुकी हैं। फिलहाल सबसे ज्यादा साउदर्न कैसोवरी मौजूद है। यह दुनिया की तीसरी सबसे ऊंची और दूसरी सबसे भारी चिड़िया है। इससे बड़े सिर्फ शुतुरमुर्ग और ईमू होते हैं। वॉशिंगटन चांद पर एक रहस्यमय मलबे को लेकर खुलासा हो गया है। 4 मार्च 2022 को एक रॉकेट चंद्रमा के सुदूर हिस्से से टकराया था, जिससे लगभग 29 मीटर चौड़ा एक अजीब दोहरा गड्ढा डबल क्रेटर बन गया था। ये दुर्घटना कोई अचानक होने वाली चीज नहीं थी। खगोल शास्त्री कई हफ्तों से इस रॉकेट पर नजर बनाए हुए थे और इस बात की भविष्यवाणी कर रहे थे कि ये कब और कहां चंद्रमा की सतह से टकराएगा। इस रहस्य को पहचान के लिए खगोल शास्त्रियों ने WEO 913A नाम दिया था।
STEM एम्पलीफायर।
आज की हमारी अतिथि हैं प्रोफेसर सुरजीत कर्माकर चौधरी। ये वर्तमान में भारतीय नैनो विज्ञान एवं प्रौद्योगिकी संस्थान में बतौर साइंटिस्ट F एवं डीन रिसर्च एंड डेवलपमेंट के पद पर कार्यरत है। इनके कार्य एवं शोध का क्षेत्र है कैंसर, न्यूरो डीजेनरेशन, मधुमेह संबंधी रेटिनोपैथी।
Good afternoon. I am Dr. Surajit Karmakar. I am scientist F and Dean R&D at this Institute of Nanoscience and Technology, Mohali. So my area of research is nanotherapeutics. We're mostly working in the area of cancer, neurodegeneration, inflammatory bowel disease and the diabetic retinopathy is current area of focus. So we are trying to develop different kind of nanoformulation and checking their efficacy in the clinical models of these diseases. Basically, this is our area of focus. And today I am going to talk about one of the drug that is called melatonin. Melatonin is basically a neurohormone that is secreted from the pineal glands, but we are using as a therapeutic molecule that is chemically synthesized. And so as because I told our area of focus is inflammatory disease, so inflammation is a process that causes many different kind of disease. So why we have chosen melatonin? Because initially we have searched few literatures, and from there our interest was there. Our working pattern is changing day by day. So people are working in the night shift heavily. So now the day shift to the night shift workers, what is happening to them? So if we go back to the background, so what we have seen is sleep is very much essential, and there are many literatures that they are saying in the terms of if someone disrupted with the sleep for a longer period of time, they may susceptible to the many different kind of disease. So we look forward how, because there are no those kind of study, but from the discrete references we concluded maybe the sleep has certain role with the disease process. So we went back and checked, and we found there is a molecule responsible for this sleep wakefulness cycle, and this molecule is released from the pineal gland and control our body's circadian rhythm and the sleep wakefulness cycle. So it means, what I am trying to say, we're supposed to sleep in the night time, and daytime we are awake. So that is due to the melatonin activity. So if we not sleep in the night time, because the melatonin is secreted in the night time more, so that causes reduction of the sleep. So if we not able to sleep in the night time due to our job responsibility, that is happening the night shift work, what will happen? So studies showed they may be susceptible to many different kind of disease, and inflammation is one of the major gateway for those diseases. So we took interest into that inflammation and trying to using this melatonin as a nanoformulation to prevent those kind of disease. Basically, we are exploring in the preclinical model to see whether inducing those disease in the model, and if we treat with this melatonin nanoformulation, whether we can prevent those kind of disease. So that is all. My past work, I have done my PhD from the University of Calcutta. Then I went for the US and Australia for my postdoctoral studies. Then I have joined here at ST as an associate professor, scientist in the year 2014. So during my PhD and the postdoctoral research, I mostly work in the cancer therapy and nanotechnology related research, and that I have trained in that specific field, and I am continuing here. So my goal is throughout my career is to preparing the drug. So now I am also doing this kind of nanotherapeutic intervention against multiple different kind of diseases, and my future goal is to make it more target specific, so we can eradicate the side effects. So as I told, currently we are getting support from the different funding agency to accomplish our research. Yeah, it's because all over the world is trying to develop certain kind of specific therapy, particularly the pharmaceutical industry. They are the main competitor. So one of the goal of our research is it's because we are 1.4 billion people in our goal to develop the drug that is economically very much viable to the people. So we can try to provide the therapy at its best with the economical context. So that is one of the goal. So that's why we try to develop the drug or its nano formulation that is little bit cheaper. That will help the common people. So in terms of science, we are exploring different kind of molecular mechanism of this disease and how we can prevent them utilizing our expertise or the nano formulation. So in terms of the, we are giving now manpower training, the master's student, the PhD students. So in that way, we are helping the, manpower to develop, to achieve their scientific training, get the scientific training, and also we are publishing in the very standard journals. So in that way, that also contribute towards the science, the new knowledge we are generating from our research. So actually our goal is to take some of the drug molecules that is available in the clinics. So we try to make their nano formulation because based upon the research, we have identified certain limitations of those drugs. So using this nano formulation, we try to overcome those limitations so that that molecule can be more efficacious in terms of the disease prevention. So in this case, we are using this molecule melatonin and making its different nano formulation, and we are checking variable inflammatory disease. So how they can prevent those inflammatory disease and showing their efficacy. Actually, the patents we have filed that are in very initial stages, but one of the important thing we can say, there is one drug available in the market that is called the paclitaxel. That is a blockbuster drug, anti-cancer molecule. So its nano formulation is also available in the market, but that is hugely costly, highly hefty priced. So that is very difficult for the Indian, patient to get and being treated. So one of the goal is to, if we can, and we have dissect that molecule in terms of the economically. So how we can narrow down the drug's cost, and accordingly we are using some other kind of molecule to replace that HSA they have used to reduce down the cost. That is one of our, using some other kind of protein that is very safe to develop that nano formulation. So normal drug is called bulk drug. So that is the chemical structure of the drug. Okay. And when we try to use them, in many cases those are the new drugs. So we mostly use them to dissolve in a certain kind of organic solvent. Okay. So sometimes they have the solubility problem. Like you cannot right away dissolve in the saline. Maybe you need to use some kind of organic solvent, dissolve it, then you can dissolve in the saline. So that is that can be useful for the preclinical trial. But if you think about the patient, you cannot use the organic solvent into their injection, through the injection to their system. So how to overcome them? So in many cases, what people are doing, they are taking that drug and they are preparing certain kind of nanoparticles. Those are very tiny particles, and incorporating those drugs into those nanoparticles. And what happens when nanoparticles having their peculiarities, certain kind of special properties, what happens when they incorporate those drugs, they change their phase. When they are in a bulk phase, they are maybe crystalline, difficult to solve. But when you incorporate into the nanoparticle, they change their phase to the amorphous. So that state change helping them to dissolve also. So in that way, it will be useful.
STEM बात पते की।
क्या आप जानते हैं कुछ धातुएं हवा और पानी के संपर्क में आते ही फट जाती हैं। दरअसल हवा के संपर्क में आने पर ये धातुएं तुरंत ही ऑक्सीकृत हो जाती हैं, क्योंकि ये धातुएं अत्यधिक क्रियाशील होती हैं। इन धातुओं में सोडियम, पोटेशियम, लिथियम, रुबिडियम और सीजियम प्रमुख हैं। उसके बाद जब इन धातुओं को पानी में डाला जाता है तो विस्फोट हो जाता है। ये सभी क्षार धातुएं हैं और इनके बाहरी कक्षा में केवल एक इलेक्ट्रॉन होता है, जिसके कारण वे आसानी से इस इलेक्ट्रॉन का त्याग कर अन्य धातुओं से संबंध बना लेते हैं।
ये था आज का विज्ञान की आवाज। आपको ये पॉडकास्ट कैसा लगा हमें बताएं mediaforcommunity@gmail.com पर।
आइए हम सुने विज्ञान की अनकही कहानियाँ। आइए हम सुने विज्ञान की अनसुनी कहानियाँ। एक नई दुनिया की आवाज आपकी आवाज, विज्ञान की आवाज, की आवाज।
Celebrating आजादी का अमृत महोत्सव, we bring you a podcast series on STEM popularization. Science, technology, engineering, mathematics and medicine. Supported and catalyzed by the National Council for Science and Technology Communication, Government of India. This program is produced by Media for Community Foundation. Creative content and technical support is given by Salam Namaste, Community Radio, Noida.
एक नई दुनिया की आवाज आपकी आवाज।